Hello and welcome to this interview event hosted by the World Federation of Public Health Associations Tobacco Control Working Group for Global Public Health Week 2024. My name is John Gannon. I'm a public health doctor in Ireland and I'm chair of the WFPHA Tobacco Control Working Group. My interviewee for this session is Dr. Paul Kavanagh, a consultant in public health medicine at the National Health Intelligence Unit in Ireland. Paul has a wide range of expertise, which includes community health, medical education, health economics, healthcare leadership, and data science. But it is his experience in tobacco that we're going to speak about today. Paul is the Public Health Medical Advisor to the Health Service Executive Tobacco Free Ireland programme. One of Paul's more recent pieces of research with the Tobacco Free Ireland team investigated opinions of a sample of the Irish population towards tobacco endgame strategies. And it is this concept of tobacco endgame that we'll discuss here today. I'm delighted to have the opportunity to interview him. And Paul, welcome. Thank you very much for your time.
Great to be here, John.
So to start us off, just so we can clarify for any viewers who are not familiar with the term, could you please enlighten us as to what exactly is meant by tobacco endgame and how does it differ from tobacco control?
Yeah, well, John, tobacco endgame is a relatively new term or new concept. So people are probably familiar with hearing the term tobacco control. But the idea of tobacco endgame, that's something that's emerged in the tobacco policy community over the last 10 or 15 years. And it probably leans heavily on ideas that people in public health will be familiar with in terms of communicable disease control. So we're talking about eliminating measles, eliminating TB, and it's a similar sort of idea. And the idea behind tobacco endgame, it's really around challenging the question as to whether or not tobacco control is a sufficient goal in and of itself. So the idea of controlling tobacco and trying to limit its harm on population health, really we're asking the question, well, is that good enough? Is that acceptable as a target? And really, when we look at tobacco as a product, it's a very deadly product. We know that it kills over 1 in 2 people who use it on an ongoing basis. People who use it lose on average 10 years of life. If it came to market in any country today, it wouldn't be authorized to be sold to the public. So really the idea behind tobacco endgame, it's about reframing the discussions and sort of moving it on from a type of a discussion where we'll go, well, this thing is bad and we'll just try and control it and we'll try and limit the harm, but it's still going to be part of society, to actually moving on and saying, no, enough is enough. This is not something that we're going to tolerate anymore. We're going to bring this to the end. And it's really around trying to, in a very radical, impactful way, get to the root causes of tobacco use at a population level. And it's about trying to permanently change the sort of political, structural, market, social dynamics that sustain tobacco use in the population. So, the final thing I would say is, tobacco endgame, while on the one hand, it's very much about a goal, it's very much about trying to move towards a society where there's minimal, if any, use of tobacco products. But I think when we think about and talk about tobacco endgame, we're really talking about a process. It's about shifting that frame of discussion and then making sure that all of the activity that flows out from our discussions is oriented towards tackling those root causes, those political, structural, market, social dynamics that are actually sustaining tobacco use and bringing that to an end.
Fantastic. Yeah, it's really kind of struck a chord there with me when you said about the idea that if you brought it to market now, it would just be laughed out of the place. You couldn't possibly introduce something like that, but we just have become accustomed to it and it's something that we sort of live with. And as you said, we try and control it, whereas now it's this idea of being more ambitious, taking it to the next level. So on that subject, what are some of the end game strategies that are being considered or have been implemented, and who are the global leaders internationally?
Yeah, so when you think about the sort of tactics that can shift things from tobacco control towards tobacco endgame, they can be categorized in a number of different ways. So one way of looking at them is thinking about tactics that are focused in on the product user. And that will be including things like trying to ban smoking in certain places. Now, the interesting thing about tobacco endgame as opposed to tobacco control is that, in fact, there tends to be less focus in on the person that's using the product. And certainly the whole philosophy behind Tobacco Endgame is that it shouldn't be punitive of individuals. Actually, it's about that much bigger picture in terms of the structural dynamics that are sustaining tobacco use and trying to tackle those. So the sort of tactics that we're talking about here would include things that are focused in on the product itself. So that would include bringing the amount of nicotine in tobacco products down to very minimal levels. And technically, we know that that's possible. And there certainly has been laboratory work showing that when you do that, the product itself immediately becomes much less appealing and less addictive for the users, and they will stop using it. The next set of tactics then are tactics that are oriented towards the industry itself. So a very well-renowned tactic in that area would be trying to ensure that there's accountability for the tobacco industry in relation to the harm caused by their products. So in some countries, for example, in America, they have been successful in terms of litigating the industry and actually holding to account in terms of the scale of harm that their product causes. And then the final set of tactics are in the area of supply. And that would include one tactic that I think probably a number of your listeners will be increasingly aware of. And this is the idea of introducing a tobacco-free generation. And this is about saying that for people born on a particular year, as they grow up across their life, it will be illegal to sell them tobacco products. And that's a tactic that we would have heard about in terms of the bold plans that they had in New Zealand. Unfortunately, they look paused at the moment in terms of some of the political change that there was around the very ambitious smoke-free New Zealand plans that they had. But that's an idea now that the UK are taking forward in terms of proposals that they have around establishing a tobacco-free generation. And for those of us that are living in Europe, the idea of a tobacco-free generation is actually something that's within the EU's Beating Cancer plan as well. And finally, then that's something that there's a degree of interest in Ireland, the country where I work. So those of us that work in the tobacco policy community, professionals like myself, civil society organisations, we've come together and we've been advising government to look at the issue around age restriction below which it's illegal to sell people tobacco products. We, in the first instance, have been advocating around a tobacco 21 type policy. So that's raising the legal age below which it's illegal to sell somebody tobacco products from 18, raising that to 21. But we would see that very much as a step towards then establishing a tobacco-free generation. I'm very pleased to say, speaking to you this evening, that's something that our own Minister for Health, Stephen Donnelly, recently on the 20-year anniversary, celebrating the workplace smoking ban implementation here in Ireland, he made an announcement saying that he personally, as a politician, was very committed to that idea of looking at the age below which it will be illegal to sell people tobacco products in Ireland.
Wow, that would be really fantastic. And I suppose a couple of things out there. We in Ireland would be proud of that achievement in 2004 of becoming the first country to ban smoking in the workplace, and it'd be great for us to show leadership again in a way like this. I mean, we saw, as you mentioned, in New Zealand, it nearly happened, and then with the change of prime minister, it got revoked. This idea of this tobacco-free generation, but no doubt countries are looking at it, as you've said, and will take note. And it's only a matter of time, I suppose, until a government somewhere has the courage and the ability to get it over the line. And it's probably something that seems not impossible, but it seems so challenging until it happens. In the same way that lots of tobacco control things, policies that we look back on, seemed very difficult at the time, like the workplace ban was such a big deal, and now it's so obvious, and it's so clearly part of our society. So it's an exciting thing to look forward to.
Yeah,
Now,
well, to take that point, actually, John, and I often paraphrase Nelson Mandela, who very famously said, everything is impossible until it's done. And it's this idea that sometimes you just need to take that bold leap of faith. And then once it's done, you look back and you think to yourself, well, look, that wasn't quite as scary as we thought it was going to be. And I think, in terms of the bold steps that are required around tobacco control, and then particularly those bold steps that will be required around tobacco endgame, that does require political leadership. And one of the ways to support our political leaders take these bold steps is to try and build an environment that helps them understand that there's a high degree of public support for the bold measures that we're encouraging them to take.
And that brings us on very nicely to the next question I wanted to ask you, which was about the research that you carried out with the Tobacco Free Ireland team that was published in 2022. And this was it was research looking at a sample population in Ireland and to find out what sort of measures they would support in terms of Endgame. And this is exactly what you're speaking about here, providing an evidence base for policymakers to use. So could you tell us about what you've learned from that research and what some of the key takeaways were, please? And I should mention also that the first author for this study was Dr. Ellen Cosgrave, and Martina Blake was also a significant contributor to the Endgame study in 2022.
Yeah, John. Well, exactly. And the rationale behind doing this piece of work was to check in with the public, because everything that we do in public health practice is about the public's health, and I think it's really important as a principle that we're always in dialogue with and listening to and informing the public about decisions and plans that we have in relation to their health. So we felt, as a Tobacco Free Ireland programme within the health services in Ireland, given that Ireland has a commitment towards a tobacco endgame goal, that it would be really important to check in with the public to see what they thought about that. And in so doing, then build that evidence base, which will provide a supportive environment for our political leadership to take those sort of bold steps that are required to make that goal of a Tobacco Free Ireland a reality. So we went out in 2022 and we asked 1,000 members of the public in Ireland, using a market research company, a representative sample of 1,000 people. We asked them their views on tobacco endgame generally, and then we systematically asked them their views on 22 particular tentative tactics that could be used to bring about tobacco endgame. And really, our findings were across 3 areas, John. So the first thing that we found was that there was really high public support in Ireland for the idea of a tobacco endgame. So actually, 3 out of 4 people were supportive in principle of the idea of moving from tobacco control towards a tobacco endgame. So that was 3 and 4 people across the population. When we broke the results down and we looked at the level of support among people who smoke, actually there was majority support for the idea of a tobacco endgame approach among people who smoke in Ireland. So I thought that was really, really interesting. And then when we dug into that a little bit deeper and we asked them different questions around this idea and principle of a tobacco endgame, what we found was that not only did the public in Ireland have a very high level of support for tobacco endgame, but actually their ideas around tobacco endgame were quite realistic. They saw this as being something that could be achieved within the next 10 years, the next 15 years. So I think that's a very important thing to underline, John. This wasn't like people thought this was a lovely notion in theory. This was actually something that they supported in principle and saw it as being something that could be realistically achieved within a set period of time. So I think that's really, really encouraging. So that's where the first area of results came back from the survey. The second area then was, as I said, we systematically went through and we assessed public support in relation to 22 different endgame tactics. And when we looked at the results across those 22 tactics, there was majority public support, over 50%, for 19 of those 22 as our public support for these specific ideas that could translate the principle of tobacco endgame into reality for people in Ireland. So the sort of ideas that people supported, in particular with a very high level support, were ideas around tobacco industry accountability and asking the tobacco industry to pay for the harm that it causes to society through its tobacco products. The other idea then that was very popular was the idea of reducing or eliminating nicotine from tobacco products so that it would be less addictive. The next idea that was very popular as well were ideas around product regulation and changing the design of the product so that it was less harmful and less addictive. Then there was ideas that were very popular around how tobacco products are supplied in the population. So people had very high levels of support for the idea that those people that are selling tobacco products should also promote stop smoking services. There was a high level of support for this tobacco 21 idea, so this idea of raising the legal age below which it's illegal to sell somebody a tobacco product. And finally then as well, there was very high public support for the idea of over time progressively phasing out the sale of tobacco products. And I think what's really interesting, John, when you look at those 22 areas, and you look at those areas, there was majority support for 19 of the 22 areas. I've called out there examples of some of the tactics there was exceptionally high support for. Actually, those concepts behind those highly supported tactics are really closely aligned with those principles underpinning the whole idea of tobacco endgame. This whole idea of moving the argument on from, oh, it's individual responsibility, it's about the person who smokes, and it's about making sure that we support them to stop smoking. Tobacco endgame really isn't about that. It's actually getting to the root systemic causes, those structural, political, market, social causes. And that's exactly where public support was highest in Ireland. So I thought that was really interesting, that the ideas that the public in Ireland supported around tobacco endgame are genuinely the sort of foundational principles of the whole tobacco endgame movement. The final thing then that we found results around was the idea of phasing out the sale of tobacco products. So when we asked people their level of support for that, 7 out of 10 people in Ireland told us that they would support the phasing out of the sale of tobacco products completely. But when we probed that with further questions and we explored that with people a little bit more, and one of the features that I thought was really interesting for the high level of support across the public that there was for phasing out the sale of tobacco products was that people were particularly quick to support that as an idea, where they saw it associated with measures that would actually support people who currently smoke, particularly support them to stop smoking. So I thought, again, that's a really interesting characteristic of this huge reservoir of public support that there is in Ireland around tobacco endgame. And it's that the general person, the public, doesn't see tobacco endgame as being something that's about punishing the individual person who is addicted to tobacco products. Actually, they want to see those people supported. They want to see the industry held to account, and they want political action to address the root causes of tobacco use at a population level. So again, in summary, a very high level of public support in Ireland for tobacco endgame. The ideas around tobacco endgame from the public, they saw this as being something that was achievable, something that was realistic, and the sort of characteristics that there were around their support for specific tactics, very, very well aligned to all of the literature and all of the thinking and all of the discussion that's happening across the tobacco policy community internationally in relation to tobacco endgame. And this idea of moving things on from a situation where we think, well, look, we'll just control the problem, we'll minimize the harm, we'll support the person who's using the product to quit, to actually radically addressing these root causes.
Fantastic. Yeah, well, that's a really great overview of the research. Thank you for that. And I agree with you. I mean, it's for so long, it's been a case of the smoker is to blame, and we see it across other harmful behaviors like fast food or alcohol, where the industry can kind of sit back and say, well, it's up to the individuals to decide it. We shouldn't be punished. We shouldn't have to do anything to change it. It's a free market type thing. And it's great that your research found that people are sick of that approach, and they want things to be done, industry held to account in particular, and the product focus interventions like reducing nicotine, or the supply focus changes like maybe making it tobacco 21 or tobacco free generation idea. So it really seems like there's an overall sense in the Irish public of support for protecting people, and not just leaving it up to every individual, because we've seen
Yes.
whatever it is, how long smoking's been around, nearly a century, that people are targeted by industry, and they will continue to be unless there's a radical change. And also very optimistic results, really, to see that people are behind it. So you can really take that to the government and say, look, we have a mandate here. People want to do this. Let's do it.
Yeah.
So that's really great stuff. And thank you so much for sharing. I have one more question before I let you go. I know you've had a very long day, and thank you for your time again. So we've talked about Ireland, and I suppose looking globally, big picture kind of a situation. What would be the priorities to move forward with Endgame? I know some countries are at a stage of tobacco control where they couldn't reach tobacco endgame yet. You need to walk before you can run. But we've made so much progress globally in tobacco control over the past few decades, despite all the efforts of the industry, we've managed to put in a lot of measures that have been really effective, in particular things like taxation and restriction on advertising, for example. What would it take to bring that progress to the next level on a global scale and achieve ambitious endgame targets like reducing prevalence? For example, one number I saw quoted was reducing tobacco prevalence to 5% of population. But what does it take to go and really hit these targets?
Yeah, no, look, great question, John, because I suppose linking back to the previous part of our discussion, we know now, certainly in Ireland, and I would suspect in many other countries as well, and the sort of public opinion work that we did in Ireland has been done in other countries as well. Actually, this is something that the public want us to deliver on as a public health community. So, we have a huge mandate there. So the question is, well, what are the sort of steps that we can take to make that a reality? Well, look, the first step, and I'm conscious I'm repeating myself now, but certainly I think making sure that you've checked in with the public and that you understand where they are at, what their thinking is, and that you understand that they have your back as a public health kind of leader to take forward this sort of agenda, particularly with political leaders. I think that's a great starting place to have, and I'm really glad that we have that in Ireland. So I would recommend that as a starting place for anybody that was looking to move down this path from tobacco control towards tobacco endgame. The next step, I think, that is really, really helpful, and this is something that we have in Ireland, and we've mobilised this in the past, particularly, for example, around the workplace smoking ban. More recently, we mobilised it around plain packaging. And this is to build kind of coalitions or movements, particularly with civil society organisations. So actually, I was talking about some of the work that's happening in Ireland around trying to work with our minister to make sure that he knows that he would have support in terms of taking steps around increasing the age below which it would be illegal to sell people tobacco products. So we've established in Ireland something that we call the Tobacco 21 Alliance, and that brings together a number of different professional bodies, a number of different public health bodies, a number of different health service bodies, a number of civil society organizations as well, a number of youth organizations as well. So we have this really broad coalition behind it as well. And I think that can be a really powerful lever in terms of change. The next thing that can be very, very important, and I'm conscious speaking to you this evening, John, that we're speaking at an event that's very much around the global community that's involved in public health, and I think that idea of a global movement is very, very important, because we know in terms of some of the bold steps that have been taken in the past around tobacco control. So, for example, the workplace smoking ban or plain packaging. What you need is one country to be the leader, one country to take that particular step, and that tends to set a precedent. And it's almost like knocking over one domino, and then all the dominoes start to move after that. So I think making sure that we have a global network, as well as those in-country networks, but those global networks, and then one country taking a lead, building the case, building the evidence around it, and sharing that globally can be really very, very powerful. I think public health leadership is really important. As public health professionals, our voice can be really powerful as a voice for change when it comes to tobacco product use at a population level and trying to move things from tobacco control to tobacco endgame. And I think we have to remind ourselves as public health professionals that tobacco remains the single leading preventable cause of premature mortality, of disease, and of disability at a population level. It's also the single biggest opportunity in terms of addressing health inequalities. And I think as well as public health professionals, we're all increasingly oriented towards the big global challenge in terms of climate change. And again, if you want to affect change around climate, focusing in around tobacco industry and tobacco product use is a really important area. So I think public health leadership is a really important step. And then I think it's about bringing all those together and actually getting a plan which is specific, measurable, achievable, has milestones in it, and is multi-component. Because I suppose, John, insofar as I've talked about examples of specific endgame tactics, actually, in reality, it's going to be a number of different tactics implemented across time that's going to bring us from where we are at the moment, which is trying to get on top of the problem, to actually bringing the problem to an end. If I was to speak about two specific tactics that I think have a lot of potential in the whole tobacco endgame arena, one tactic that I think as a public health community we need to keep coming back to is the idea of very low nicotine content tobacco products, because people, it's the nicotine in tobacco products that make them addictive and mean that people get addicted to the product and continue to use it. And there's lots of evidence from different studies that have been done, up to and including modeling studies at a population level, that have shown that if you want to very rapidly reduce tobacco product use within a population, making the products, ensuring that the products are regulated in a way that they have very low nicotine content, is a very, very effective way of rapidly reducing the tobacco product use at a population level. And I think that idea around very low nicotine content tobacco products is something, as a public health community, we really need to get that message out there, that that's actually technically feasible, and it's about bringing in the regulations to make that happen. And that could literally, over a number of months or a year or two, see very dramatic reductions in terms of tobacco product use at a population level. The other tactic that I would call out, John, as probably warranting specific attention, is the idea of a tobacco-free generation. So this is the idea that you would say, at a point in time, everybody born from this year onwards, for their entire life, could never be legally sold a tobacco product. Now, in contradistinction to the very low nicotine content policy for tobacco products, which I said is a very rapid game changer, the idea of a tobacco-free generation is something that would have effect, but it would have effect over a much longer period of time, so it's more of a slow burn. But the reason that I think that it's particularly worthy of attention is that from a public health leadership perspective, garnering public and political support around the idea of protecting children is something that's a very, very powerful lever, So I think in terms of advocacy and garnering political support, the whole idea of a tobacco-free generation is another specific example of a tobacco endgame tactic that I think is worth bringing into our discussions as public health leaders around moving from tobacco control towards tobacco endgame. So there are two tactics that I would call out as warranting specific kind of discussion in terms of tobacco endgame. But as I said, I think ultimately, John, the delivery of a tobacco endgame is something that's going to take a number of different tactics, and those tactics delivered across time.
Fantastic, really, really, really inspiring stuff, and you're making me feel like we can do it. From listening to you talk. Definitely the idea of the leadership. I mean, this is global Public Health Week. This event is going out over. So as you said, it just takes one country to stick their neck out a bit. Like we were there with the workplace ban, and I think Australia were the first ones to properly do the plain packaging. And now New Zealand nearly did the tobacco-free generation. So it's something that if one country kind of breaks through a bit of a shield or any kind of makes that headway, people can follow on and take it from there. So really exciting stuff. Loads of interesting content covered there, Paul. Thank you so much for sharing your experiences and your insights with us today. I should just mention that the Tobacco Control Working Group, we're carrying out research of our own at the moment. We're looking at the opinions of 18 to 34-year-olds, young adults, on kind of two topics. One is tobacco endgame strategies, and the second is on the subject of vapes or e-cigarettes and their health harms. And a lot of it is similar to what we've discussed today. We're looking at opinions of people. What restrictions would people be in support of? And what might be advised in terms of things like the tobacco-free generation or low nicotine content cigarettes, and a range of other measures that could be brought in. So if you found this video interesting, please go ahead and check out the survey. The link will be with the description. It'll just take less than 10 minutes, and it could be really useful. Your opinion could effectively influence policymakers, governments, and we're looking for a kind of a wide range of international applicants to fill in the survey, so we can compare globally as well and see what people think around the world. There's also another video we've recorded with another one of our members, Dr. Michelle Janganilis. She's a behavioral psychologist based in Melbourne, and she spoke to us last week about vapes and her experience with those, and how the tobacco industry has taken them on and used them as a way to get young people into nicotine addiction, and her opinions on that as well. So if you enjoy this video, it's worth checking that one out as well. I'd like to just extend my thanks again to Dr. Paul Kavanagh for his time, and I hope you enjoyed this.